Hi, I'm Christina. I'll be your PA today. Can I ask you what brought you in to see me?
I'm having really bad stomach pains.
Okay, and how long has this been lasting?
You know, it happens like randomly. I can't really figure out why or what causes it.
Okay, do you know how many days ago it started?
Probably like 7.
Okay. Do you know what you were doing when you first noticed it?
Usually I'm eating and then I get pain.
Okay. And has anything made it better?
Not eating.
It's not a very good solution.
I know, that's why I'm here.
Does anything make it worse?
Eating.
Eating?
Yeah.
Okay, anything else?
That's it.
Okay. And since it started, you said it's been intermittent, like come and go?
Yeah.
Just
It's not constant. It'll like happen and it'll go away and then it'll happen again. Usually when I'm eating.
Has it ever like been worse at a certain time, or is it always around like the same?
This morning it was really bad. That's why I made an appointment for today.
Okay. And has this ever happened before?
No.
Does it radiate anywhere? Do you feel the pain anywhere else?
Yeah, so it's in my stomach here, but like sometimes my chest hurts.
Okay. And how would you describe the pain if you had to like describe it with some like adjectives?
It's like a burning sometimes, just like severe discomfort.
And on a scale of 1 to 10, how would you rate it?
Normally it's like a 4 or 5, but this morning it was like a 7.
Okay. I'm sorry you're going through that. It's very hard.
Yeah.
Have you noticed any other symptoms going along with that?
Just like almost heartburn or chest pain.
Okay, is that all the time, or is that associated with when you eat?
It happens like along with the stomach pains. Like when I eat,
Okay.
like my stomach hurts, and then I start to get like chest pain.
Okay. And the same things make it better and worse along with the stomach? Okay. Have you ever had the chest pain or heartburn before?
Mm-mm.
Okay. And how would you describe that pain?
It's like a burning sensation.
Okay. And if you could rate that on a 1 to 10, 10 being the worst pain you've ever had?
Probably like a 6.
Okay. I'm just going to go through some other symptoms to see what else has been it's affecting.
Okay.
So have you had any trouble swallowing?
No.
Okay. You said you have had heartburn.
Yeah.
Any loss in appetite?
I mean, it kind of makes me not want to eat because it hurts.
Yeah.
I mean, I want to
that.
eat, but like it hurts. I don't.
Does it come with any nausea?
Sometimes.
And are your bowel movements the same? Any changes?
They're like a little less.
Okay. Any change in the stool color or size?
No.
Do you have any pain with that?
Yeah, a little bit.
Any bleeding? Actual bleeding?
It happened once, but not normally.
Okay. Any black or tarry stools?
No.
Any hemorrhoids?
Mm-mm.
Constipation?
No.
Diarrhea?
That happened once.
Okay. You have abdominal pain.
Mhm.
Any food intolerances?
Fast food doesn't really help.
Okay. Any excessive belching?
Yeah.
And how about passing of gas?
Yes.
You don't, no jaundice? Any liver or gallbladder trouble?
No.
Or hepatitis?
No.
Okay. So, have you had any usual weight change?
Yeah, I can't really explain it. I don't know, but I've been losing like a lot of weight. Or I've lost a significant amount. My clothes fit me like weirdly now.
Do you know how much you've lost?
No, I don't have a scale at home, so I didn't measure.
You said your clothes are now fitting looser.
Yeah. My pants are falling down today at school.
Oh my goodness. Do you have any weakness,
No.
fatigue,
No.
or fever?
No.
And any heart trouble?
Just the burning. Not really. I don't know if it has to do with my actual heart.
Yeah, but it feels like it's
Yeah.
there.
Yeah.
Any high blood pressure?
No.
Rheumatic fever?
No.
Any heart murmurs?
No.
I said yes to chest pain. Any palpitations?
No.
Shortness of breath?
Mm-mm.
Do you ever have to use pillows at night to prop yourself up?
No.
Do you have any swelling in your hands, ankles, or feet?
No.
And have you had any recent EKG or other cardiac testing?
No.
Okay. Do you have any allergies that you are aware of?
Cats. I'm allergic to cats.
Do you know when you found that out? Was it?
In my childhood, I don't really know. I just
Okay.
know we were never allowed to have pets in the house.
That must have been hard growing up.
Yeah, I always wanted a dog.
And are you on any medications?
Just birth control.
Do you happen to know what the name of it is?
It's a combined pill. That's all I know.
And do you know the dosage of it?
Mm-mm. I take it once a day.
Is it a pill?
Yeah.
Okay. Okay. And do you have any significant childhood illnesses that you remember?
I don't think so.
Any measles,
No.
mumps,
No.
rubella,
Mm-mm.
whooping cough,
Mm-mm.
chickenpox,
No.
rheumatic fever,
No.
scarlet fever,
No.
polio,
Mm-mm.
diphtheria,
No.
or psychiatric disorders.
Nope.
Okay. And do you know if you had all of your childhood immunizations?
I think so.
Okay, so polio,
Yeah.
MMR,
Yep.
tetanus,
Yes.
diphtheria,
Yes.
rotavirus,
Yes.
Hep B,
Mm-hmm.
chickenpox,
Yes.
and pneumococcal.
Yes.
Okay. Do you have any illnesses now in your adult health?
No.
No thyroid disease,
Nope.
heart disease,
Nope.
hypertension,
Nope.
hyperlipidemia,
Mm-mm.
diabetes,
No.
COPD or asthma,
No.
cancer,
No.
HIV,
No.
hepatitis,
No.
Kidney disease,
No.
blood clots,
No.
and any psychiatric history.
Mm-mm.
Okay. And have you had all of your adult vaccinations?
Yeah, but I never got the flu shot.
Never the flu.
Mm-mm.
Okay, you have had the Hep B booster, the zoster,
Yeah.
and pneumococcal.
Yeah. I'm actually working on my Hep B right now. I currently don't have immunity.
Working on it. It's
Yes.
a good thing to have. Okay, do you have any adult illnesses? I guess childhood as well. Major.
No.
Okay, any accidents or injuries?
Yeah, when I was like 3, I had nurse's elbow. So like my dad and my uncle popped my elbow out by swinging me.
Oh wow. And you said that was when you were 3. So.
Yeah, so that was like 2000, I think.
Okay.
I had to go to the ER and they just popped it back in.
Oh
And
my
then everything
goodness.
was fine.
And it healed well?
Yeah. There's like a dislocation, so they just put it back in.
I'm glad that healed.
I also tore my ACL partially.
And what year was that?
Last year.
Last. Okay, any treatment for that?
I just did physical therapy and rest, ice, elevation, compression.
Any complications with that?
I don't think so. I mean, no, but I have to be careful or else
Yeah.
I could like further injure it.
Okay, any hospitalizations?
No.
Okay. Any surgeries?
My wisdom teeth. Does that count?
Yes, it does. When was that?
Oh, that was 4 years ago, so 2014.
Do you happen to know where it was done in the?
Yes, it was done at Dr. Leavenworth was my doctor, and it was at his office, which is also named by him.
Okay. And where is that?
It's in Alexandria, Virginia.
Okay. Any complications with that?
Yeah, actually, I ripped open some of my stitches, so I had to go back and get those fixed.
And then afterwards, did that heal well?
Yeah.
Any other surgeries? Okay. And have you had all of your health screenings up to date?
I think so, yeah.
You have your immunizations. Have you had a cholesterol screening?
No.
A mammography? Or like screening for TB?
Yeah, like a couple months ago.
Okay.
It was negative.
Negative? Good. Any lung cancer screening?
I haven't been screened for it, but I probably should be soon, like whenever that is, because it runs in my family.
Oh, okay. It's good to know for yourself that you need to get checked.
Mm-hmm.
You probably haven't had a colonoscopy yet. A pap smear?
Yeah.
And do you know when the last one was?
5 months ago. I think it was in June or May. It was in May.
Okay. Good. Okay, so I'm just gonna go through your menstrual history. When did you get your first period?
I was 14.
Okay, and how long is your regular cycle?
Usually 3 to 4 days.
Okay. And is that heavy, light?
The first day is heavy and then the rest is super light.
Okay. And when did your last menstrual period start?
2 days ago.
Not going through menopause. Have you ever had any absence of your period?
Yes.
Could you tell me a little bit more about that?
It was during high school. I'm pretty sure it was during basketball season.
Okay. How long did that last?
Like 3 months.
Okay. And any painful menstruation?
Cramps, but those are normal to me.
Normal.
Yeah.
Okay. And you had your last Pap smear in May,
Yeah, that was my first one.
and it came, I'm guessing, normal.
Mm-hmm.
Okay. Have you ever been pregnant?
No.
Okay. And do you have any, you said you're on birth control?
Yeah.
Okay. Any other contraceptive methods?
No.
Okay. Okay, I'm just gonna go through your sexual history a little bit. Are you sexually active now?
No.
No. Okay.
Not like currently.
Right, but recently, within the last 6 months?
Oh, well, yeah.
And how would you describe your gender?
I'm a female.
And how would you describe your partner's gender?
Males.
Okay. Do you ever use protective barriers?
Birth control.
Birth control?
Yeah. Sometimes a condom, but like probably 50% of the time.
Okay. Intimate with anyone else? So not sexually active right now.
Mm-mm. Not currently.
Any new partners in the last 6 months?
Yeah. 2. Well, 1 in the
One.
last 6 months. Yeah.
Okay. Do you have any history of STIs?
Yeah.
Yes. Okay. Could you tell me a little bit about that?
I had gonorrhea.
Were you treated for that?
Yeah. Definitely.
And it healed or went away? Oh, okay.
Yeah.
Okay. No complications. Do you feel safe at home?
Yeah.
And do you feel respected by all of those around you, your family, your friends?
Yeah.
And do you have any questions or concerns for your sexual health, or any questions or concerns?
No.
about it?
Not right now.
And do you have any psychiatric
Mm-mm.
history? No?
No.
Okay. Now I'm going to go through your family history, so that includes, you have no children, so just your parents and your grandparents. Okay. So is there any, or do you know of any significant family history?
Yeah, so my maternal grandfather passed away with colon cancer that metastasized to the lungs.
I'm sorry to hear that.
And
Do you know how old he was when he passed away?
he was like 74, I think.
Okay.
There's also a history of gastrointestinal cancer in my family.
Do you know of anyone who's had that?
Yeah, my maternal grandmother.
Is she still living?
Yeah, she's in the hospital though, so
How old is she?
she's 76, I think.
I'm sorry to hear that. She's in the hospital.
Yeah, it's rough.
Okay. Do you have any family history of headaches?
Yeah, my mom gets bad migraines.
Any seizure disorder?
Well, yeah, but he's not my blood related cousin, so that doesn't really count, right?
No,
Okay.
not for this purpose. Any stroke,
Nope.
mental illness,
My dad's mom, so my paternal grandmother is a little senile.
see,
I don't remember exactly what she was diagnosed with though.
any suicide,
No,
substance abuse,
no,
thyroid disease,
no,
coronary artery disease,
no,
hypertension,
nope,
hyperlipidemia,
nope.
diabetes, asthma,
My grandfather, my paternal grandfather has asthma. Yeah. He's also allergic to like everything under the sun.
lots of allergies.
Yeah.
Probably does not help his asthma.
No.
Any tuberculosis, renal disease,
No.
arthritis,
My grandmother has arthritis. My paternal grandmother.
okay, any allergies, family,
Cats run. My mom, my sister, and I
Cats.
are all allergic to cats. And then my grandpa has like everything.
and then any genetically transmitted disease.
No.
Okay, I'm just gonna go through a lot of yes/no questions, but just to get an overall sense of your overall health.
Okay.
So for your skin, have you noticed any rashes,
No.
lumps,
No.
sores,
No.
itching,
No.
dryness, a change in your skin color,
No.
a change in your hair or nails,
I mean, my hair is really dry, but I think it's just because I need a haircut. I'm serious.
yeah, mine gets like that too before I need a haircut. Any change in the size or color of your moles?
I don't think so.
Okay. Have you had any headaches recently?
Sometimes.
Have they increased in frequency?
No.
Okay.
Kind of random.
Good.
Blame my mom.
Any head injury?
Nope.
Dizziness
No.
or lightheadedness? Okay. Any change in your vision?
No.
And you wear glasses?
And contacts.
And contacts. When was your last eye exam?
Ooh, June, I think.
And do you have any pain in the eyes?
No.
Redness?
No.
Excessive tearing?
The other day I did, but I think it's just because I need a new pair of contacts.
Yeah.
Sometimes I forget to change them.
Any double or blurred vision?
No.
Spots? Do you see specks? Flashing lights? Any glaucoma or history of glaucoma?
No.
Any cataracts or history of cataracts? Okay. Has your hearing changed recently? You can hear well?
Yeah.
Normal? Okay.
Yeah.
Any tinnitus?
No.
Ringing in the ears? Vertigo? Any dizziness?
No.
Earaches?
Nope.
Any infection
No.
or discharge? And do you use hearing aids?
I do not.
Okay. Have you noticed any frequent colds?
Yeah, I had this cold for the past, I don't know what it is, 2 weeks. Like my nose is all stuffy and it won't go away. I thought it was just the change of seasons, but I'm not really sure how to get my congestion to go away.
You said it's been lasting for 2 weeks.
Yeah. I don't know if it's like school is stressing me out or I haven't been sleeping enough or like the weather because it's been so rainy and cold recently.
Have you tried any over-the-counter medications?
Yeah, I tried NyQuil, and Dayquil, and Sudafed, and
Has that helped at all?
I don't think so.
We'll have to look into that, see if we can get you anything. With that, do you have any discharge?
Like snot?
Yeah.
Yeah, a lot.
Any itching? Hay fever?
I don't think so.
Any nosebleeds?
No nosebleeds.
Or any sinus? You said you have congestion.
Yeah, it's like constant, it won't go away.
Sorry to hear that.